Hello everyone. In this video we're going to be looking at a few previous year questions and we're going to be looking at why the option is correct and why the other options are incorrect. So let's start with the first question. The following are features of Fragile X syndrome except trinucleotide mutation in the FMR1 gene, mental retardation, microorchidism, which means small testes, or large ears. If you want to take a moment and try it yourself, so you can just pause the video and then we'll see what's the correct answer. So to answer this, you need to know what is Fragile X syndrome. So if you will visit my Instagram page, there I've posted a lot of such pictures describing the different types of syndromes. So I suggest that you go look at them because they are very high yield. So anyways, let's see what is Fragile X syndrome. So here there is a mutation in the FMR1 gene where there are more than 200 CGG repeats. So but for now let's just focus on the options. So here in the clinical features there are big ears and this was in the option, so this is correct. There is intellectual disability and again more than 200 CGG repeats in the FMR1 gene. So all of these three options are correct. But here there are enlarged testes, not microorchidism. So coming to the question again, here the answer will be microorchidism because the question was except. Okay, now next question. Alpha-1 antitrypsin is the major inhibitor of the enzyme catalase, collagenase, elastase or phospholipase. So let's try to understand this. Here we have the lungs. So normally what happens is whenever you are smoking or any pathogen comes, the neutrophils will come and they will release proteases. One of them is elastase. And what this elastase will do, it will destruct the elastic fibers of the lung. But here is where the alpha-1 antitrypsin comes in. It comes and inhibits these proteases, and in a way it will protect the lungs from these elastases. Also a side note, there is a disease called alpha-1 antitrypsin deficiency. So you can understand if there is no alpha-1 antitrypsin, the elastase are going to destroy the elastic fibers of the lung and this is going to cause a disease called emphysema. Okay, coming to our options again. So here the correct answer is elastase. Okay, now next question. All are true about Barrett's esophagus except it is a complication of chronic GERD. It is seen in 10% of individuals with symptomatic GERD. There is intestinal metaplasia seen and it increases the risk of squamous cell carcinoma. Okay, so Barrett's esophagus is a complication of GERD. GERD or gastroesophageal reflux disease is a condition where the acid from the stomach goes to the esophagus. This can happen due to a lot of reasons. For example, if the lower esophageal sphincter is not working, the acid will be able to go through the lower esophageal sphincter into the esophagus. And if this keeps happening again and again, the lining of the esophagus will change and the lining will become more like the lining of the small intestine. So what is this condition called? This is called intestinal metaplasia, where the lining changes and it also increases the risk of adenocarcinoma. So coming back to the question, here the correct option is D because as we just saw, Barrett's esophagus increases the risk of adenocarcinoma, not squamous cell carcinoma. All the rest of the options are correct. Okay, now the most characteristic cardiovascular defect seen in rubella is pulmonary artery stenosis, coarctation of aorta, ankylosing spondylitis, or rheumatic fever. So this is also very easy. So congenital rubella is characterized by a triad. This triad includes sensory neural deafness, cataract, and pulmonary artery stenosis. So you will have to learn this triad. And coming to the question, what was being asked? The most characteristic cardiovascular defect. So the answer is pulmonary artery stenosis. Next question. Choose the anti-apoptotic factor from the list below. Is it P53, KRAS, BCL2, or BAK? So if you know this from pathology, very good. If not, so let's see what's the correct answer. So BCL2 is B cell lymphoma 2 and in fact this is the most well-known anti-apoptotic factor. So this is your answer. What about the other options? So P53 is a tumor suppressor protein and it is not an anti-apoptotic factor. KRAS is an oncogene and also not the correct answer, and BAK is a pro-apoptotic factor. So the correct answer here is BCL2. Now, what type of necrosis is seen in the vessel wall of polyarthritis nodosa? Is it fibrinoid necrosis, gangrenous necrosis, fat necrosis, or caseous? So what is polyarteritis nodosa? So it is a condition where there is systemic vasculitis of small and medium sized muscular arteries. It affects the renal and visceral vessels but spares the pulmonary circulation. And during the acute phase, there are mainly two things that are seen. One is a luminal thrombosis and second is a fibrinoid necrosis. So this is our answer. What about the other options? Gangrenous necrosis is typically seen where there is severe ischemia. Fat necrosis is a type of necrosis seen in fat tissue, usually after a trauma or inflammation. And caseous necrosis is mainly seen in tuberculosis. So out of these options, our correct answer is fibrinoid necrosis. Now, which lymphoma is highly linked to BCL2 overexpression? Is it follicular lymphoma, Burkitt lymphoma, diffuse large cell lymphoma, or chronic lymphocytic leukemia? So as we just saw in the previous question, BCL2 is anti-apoptotic, and this is seen in about 85% of follicular B cell lymphomas. So it is so common in this condition. So hence this is our answer. And why does this happen? It occurs due to a 14-18 translocation. So coming to our question, follicular lymphoma is the answer. Now, aneurysm is a post-MI complication caused by which of the following myocardial infarctions? Is it subendocardial, anterior transmural, posterior transmural, or inferior wall? So aneurysm here is a bulging or outpouching of the weak muscle wall, and this is seen after a full thickness, meaning transmural infarct that has been replaced by fibrous tissue. Now I will quote a direct line from Robbins. It says that a late complication, aneurysms of the ventricle, most commonly results from a large transmural anteroseptal infarct. So it is transmural and anteroseptal. So coming to our question, option B is the correct answer. Punched out ulcers are seen in the esophagus which are caused by herpes simplex virus, cytomegalovirus, candida, or by acid. So let's start eliminating options one by one. The acids do not cause punched out lesions. They can actually directly cause necrosis of the wall. Candida leads to gray white pseudomembranes. Cytomegalovirus, it leads to shallow lesions where you will see infected endothelial cells with nuclear and cytoplasmic inclusions. So in cytomegalovirus, the inclusions are located both in the nucleus and in the cytoplasm. This is pretty characteristic. But in herpes simplex virus, here yes, you will see punched out ulcers. So here the correct answer is A. Now, which of the following disorders is most frequently linked to Down syndrome? Okay, let's try to understand this. So what happens in Down syndrome? There is an extra copy of chromosome 21, right? So due to this, the genes on chromosome 21 are overexpressed. And there is one gene that you have to remember by the name of amyloid beta precursor protein, or APP for short. And this protein is the main culprit here which leads to the pathogenesis of Alzheimer's disease. That's why here our answer will be Alzheimer's disease. So that's it for this video. If you have any doubts, so please leave them in the comments, or you can message me on Instagram anytime. The link to my Instagram is in the description. Thank you.